Hey guys, I'm Dr. Ruth Roberts. I'm the creator of the original CrockPet Diet, and welcome to my live broadcast for this week. Had several questions come in, and some of them are more meaty than others and take a little bit longer to explain. So I'm going to start with the last one first. That's kind of easiest to explain. So Susan wrote in and asked, why are so many cats dying from kidney failure? And she says she's always fed a grain-free holistic food. And so here's the short answer. The short answer is dry food. So essentially what we've done is take these creatures that are obligate carnivores and feed them a dry food that is very high in carbohydrates. And so what that does is it dries them out even further. And so if you operate in this chronically dehydrated state for too long, then the kidneys are going to take a beating, so to speak. And this happens in us too. So for all you folks that are coffee junkies and soda junkies and all of that, that's what happens to us as well. So we stay chronically dehydrated. We're more likely to develop kidney disease because our kidneys don't get the support they need as far as flushing stuff out. Hey, Alicia, good to see you. So the second part of that answer is I've always fed of grain-free holistic food. So that's great. The thing is that the marketing makes you think that grain is all evil. And in fact, many grain-free foods are still extremely high in carbohydrates. So if you'll remember, I started out saying that cats are obligate carnivores. So that means that their diets should be something like 40 to 50% in protein, and then the rest fat, and then the rest extremely low carbohydrate, like less than 10%. So, and in reality, what's being fed to them is something like 60 to 70% carbohydrate, even if it's a grain-free food. So if you look at that, you're going to see other sources of carbohydrate like chickpeas or peas or, rice or something else. So grain, rice is technically a grass, not a grain, but wheat and oats and things of that nature are grains. So we're still not feeding them the right mix of macros. So essentially too much carbohydrate, too low in protein, too low in fat. And what that ends up doing is a high carbohydrate diet is pro-inflammatory. And so that has an impact on the entire body and especially the kidneys. And, that's being borne out in human nutrition studies. I talked about the Pure Nutrition study that was released on the human side about 3 weeks ago. So if you haven't read that, go check it out. Essentially what it said is that people that ate a higher fat diet had a much longer and happier life. So what I've been telling you for years is finally bearing out in research that's acceptable even to people that believe in evidence-based medicine as the only way. So that's two reasons. And then the third reason, which kind of, maybe it's true, maybe it's not true. I'm not sure. The evidence is suspicious. Some studies have borne it out, some studies have not. The third issue is vaccinations. For cats, their vaccines, the antigens are grown in cat kidney cells. And so even though that serum is purified, there are still some proteins of cat kidney cells in the serum. Now, the theory is that because that's being injected along with the things that stimulate the immune system to protect the cat against whatever disease we're vaccinating against, that the immune system also learns how to develop antibodies to that, to their own kidney cells, essentially. And so that's clearly not a good situation. So again, research is a little sketchy there, so I can't tell you definitively that that's the case or not the case, but it certainly makes sense to talk with your veterinarian about vaccinations. Dr. Schultz, who's done so much work in researching vaccines for actually all of the vaccination manufacturers, has found, starting back in '99, that the duration of immunity after a kitten has been boosted is at least 4 to 5 years, and probably closer to 7 years, which he equates with lifetime protection. So that is where titers become very effective to see if your cat is still protected or not. The one place where this is a potential issue is the rabies virus vaccine. However, that one is generally not grown in cat kidney cells. And so if you're using the regular one that dogs would also use, then there is much less risk for creating that potential autoimmune reaction. So that's what I can tell you, Susan. It's really, I keep saying this, and the reason is it's true. The worst thing we've ever done to cats is feed them a bag of dry food. So I think that really is responsible for not only kidney disease, but also bladder disease, crystals, stones, etc., obstruction, irritation. Again, because they are chronically dehydrated, so the urine is so concentrated that it ends up irritating the bladder, even if there's no crystals present. And then certainly you throw crystals on top of that. That makes a bad situation worse. So that's what I can tell you about that. The next question from Patsy is about her Goldie, who was recently diagnosed with pulmonary fibrosis. And this is a more complex question. She goes on to say that it was a shock because she's not symptomatic, and she's got a wood stove that they use fairly regularly during the winter for supplemental heat. And she's concerned that the smoke that inevitably comes out will create issues for her dog or worsen the condition. So here's the interesting thing. I mean, generally, when pulmonary fibrosis is diagnosed on X-ray or through symptoms, the dog is already pretty sick. So I'm happy that things were caught early. It is a slowly progressive disease, and it involves the destruction of lung tissue by scarring, essentially. So there's some sort of issue as far as the immune system probably attacking the lung tissue. Maybe there was something that was reasonable to start with, and then the immune system goes overboard about it. So what happens is fibroblasts get laid down and end up scarring the tissue, and then the lung tissue becomes essentially just like a big glob of stuff hanging out and creating issues. I knew a woman that actually had pulmonary fibrosis and ended up getting a lung transplant many years down the road. And it was awesome to see her picture in the paper completing the Cooper River Bridge run. For dogs, we don't have those options. And so what and unfortunately too, things like prednisone and other immunosuppressive drugs have not been helpful with it. And then finally, this disease is more common in Westies due to a genetic defect. Generally, it's diagnosed by either biopsy or a CT scan when it's suspected. And the other thing that's important too is that it can be caused by and cause pulmonary hypertension. So I think that the thing that's important here, as far as finishing the workup on the Western side, is to go ahead and see a veterinary cardiologist. Make sure that this is not heart disease masquerading as lung disease, and to make sure that pulmonary hypertension is not present, because that is one thing that can be treated that can help minimize the symptoms and also slow the progression of the disease. So is the wood smoke going to make things worse? And my guess is probably not, because at this point the pup is asymptomatic. And so until things start to change to the point where she develops symptoms, that's when you may begin seeing irritation. Now, as far as things that you can do to help kind of slow this process down, N-acetylcysteine has been demonstrated to be helpful even for the evidence-based medicine folks. So there are several papers out on that. That seems to work well. And then I think quercetin would be helpful in this situation as well. I use it in kidney disease because it prevents the deposition of advanced glycosylation end products, or AGE, appropriately named, which end up causing the scarring of the kidney cells and causing destruction of functional kidney tissue. And then the other thing, so it's a bioflavonoid and a very potent antioxidant. And then the other thing I suspect may be helpful is rutin, which is also a bioflavonoid. And that's been used typically more often in things like pulmonary effusions that may or may not be caused by cancer. It seems to reduce the accumulation of fluid in the chest. And so to me, what that means is that it probably is going to help reduce the fibrosis and scarring and reduce the body's reaction to it. Because I think one of the end stage problems with this disease is that because this abnormal tissue is in the chest, that fluid does tend to accumulate around it. So I think that, and then the third thing, of course, is going to be weight loss to a normal body weight, body condition score, simply because it's going to reduce the work burden on the lungs and reduce the overall inflammatory level within the body itself. And then certainly eating an anti-inflammatory diet. So part of our goal is going to be to reduce the body's inappropriate inflammation reaction to what's going on in the chest. And certainly along with that, fish oil is going to be helpful at high dose. And then probiotics, again, when they're in charge of the gut, they are responsible for making anti-inflammatory molecules and modulating the immune system. So if over 70% of our immune system is actually in the gut, and it's not us, it's them, the probiotics that are controlling the immune system, it's important to keep the good guys in charge there. So I hope that's helpful, Patsy. I would definitely, if you haven't already, go get in contact with a veterinary cardiologist and make sure that your pup does not have pulmonary hypertension. And CT scan may or may not be necessary, although it's a little, I think that's really the main way to diagnose it. I think plain x-ray films rather, are too generic, and there could be some other things that may be at play as well. But I think I would get that checked out and just double check, because pulmonary fibrosis is horrible. But if there's something else going on that can be adjusted and supported better, then if that is the case that this is the diagnosis, then that will help slow things down quite a bit. So hope that helps. And then we had two questions on crystals in the bladder and the CrockPet diet. So there is one lady that wrote in that said that her veterinarian said that her dog has crystals in her bladder, and if the stones are found on x-ray, she'll need to place her on a prescription diet, and she just started both of her dogs on CrockPet. I don't know what to do with this idea. Any thoughts? And then a second person wrote in and said she was considering putting her kitties on CrockPet Diet, but wanted to make sure it was the best idea based on her cat's issues, which are Pota dermatitis and bladder crystals. So Pota dermatitis is a fancy way to say inflammation of the feet, but it can be really quite remarkable. And if you Google pillow foot disease, it's really kind of bizarre. So that's an autoimmune disease as well. And so here's the way we work with crystals. And I've had another person write in and say that the CrockPet diet, her veterinarian is saying the CrockPet diet is the reason why the dog has calcium oxalate stones. So let me kind of explain things a little bit. When you feed a lot of vegetable material, you tend to alkalinize the urine. And so if optimal pH is somewhere between 7 to 7.5, alkaline is going to be greater than 7.5, acidic is going to be less than 6. So there's two types of bladder crystals. The first are struvite crystals, and they form in an alkaline environment. Struvite stones can be dissolved using urinary acidifiers, and also in some cases antibiotics. For dogs in particular, typically these stones form around an infection, and then it's like a snowball literally. It just sort of rolls down the hill and gets bigger. So antibiotics can be important for dogs because as the stone dissolves, it releases bacteria back into the bladder, which can cause a bladder infection. And it's important to realize as well that you may have several different layers of bacteria present. In cats, typically infection or bacteria is not present in these stones. So that's where a urinary acidifier helps. Most of the prescription foods are designed, all they are, if you look at the label, is chicken and corn with stuff added to either acidify or alkalinize the urine. And so that's where I really draw exception. I don't think that the CrockPet diet caused calcium oxalate crystals. Again, the explanation being that the vegetables typically alkalinize the urine, and calcium oxalates must form in an acidic environment. So I think that's unlikely. But what do? We have seen patients come up with crystals on the CrockPet diet, and here's what we do. We use either vitamin C or methionine to help acidify the urine and bring it back down to that 7 to 7.5 range. And typically what will happen is that those stones will begin to dissolve. There are also several Chinese herbals that can be used to help make that go a little bit faster. And then, if it's really awful, like I hate to say this, and I still don't understand how this happens, but I've seen plenty of dogs walk into the office. They just started peeing blood, and literally they have a bladder full of rocks. I mean, no kidding, this many. And they've been fine up until that day. It's stunning to me how much they put up with and accommodate to. They are certainly far more gracious than we are with their health issues. So that's struvites in an alkaline environment. And hey, Lisa, good to see you. Glad you're able to tune in. So calcium oxalates are in an acidic environment. So you can alkalinize the urine using baking soda, which is kind of the simplest. And there's, you just start small and work your way up. And by the way, you will want to be testing your pet's urine to make sure that you're getting in the right ballpark. The easiest way to do that is to get pH strips, and then for dogs, use a cookie sheet or something like that to catch a few drops of urine. Watch put a drop on the strip, watch the color change, and then match it to the color scale on the box of strips. With cats, it's a little bit more difficult, and so people will use something called Kit for Cat, which is a sand that is treated with something that makes the water stand up on top of it. But that's the easiest way I can tell you to get a urine sample from a cat. Other people have used lab litter, which is basically plastic beads. When they made the packing peanuts out of plastic, that was actually pretty awesome because cats would go into the bathroom in there. So that's how you would do it for a kitty. You want to take, first morning urine and always test that one so you're consistent, because urine pH is going to vary throughout the day based on what your pet has or has not been eating. And in the morning, they've had at least a 12-hour fast, so that's going to be more representative of what's accurate. So the trouble with calcium oxalate crystals and stones in particular actually, is that they typically don't dissolve well using just adjusting the pH. And I have had success in dissolving some of the smaller ones, but unfortunately many of these do require surgery to get under control. There's Chinese herbals that are used to dissolve these stones, some of which, and they've been sort of dicey. There's the main ingredient, dianthus, had been on back order, and so what that means is because all of the herbs come from China, there was probably a contaminant found. So they kind of are available sometimes, sometimes not. Kan Herbs makes a great version of 8 Righteous, which is Bajingsan, and that's helpful. That's kind of the basic formula that these stone dissolving formulas are built on. So that's a consideration as well. Now, as far as I hope that explains, I think that answers the question about do you need a special diet if your dog has or cat has bladder stones, and to me the answer is no. You can do the same thing based on what your pet's pH is by adding an acidifier or an alkalinizer based on where the pH is. So to the other lady's question about preventing bladder crystals with CrockPet Diet, and the cat has Pota dermatitis, I think the CrockPet Diet is a fantastic choice. Again, we're feeding an anti-inflammatory diet, which is going to help any type of autoimmune disease, which Pota dermatitis is. So yes, and with cats, remember, it's getting them to change food can be onerous. There are a few cats that don't care, they'll eat everything. I caught my cats eating my spinach before I had a chance to cook it last night. It's like, really, guys, you don't get enough. But anyway, that's them. They're pretty, they'll eat anything that's put in front of them practically. There are other cats, and I talk about my cat Romy, that it took me 6 months to convert her from dry food to canned food, and then another 3 months from canned food to cooked food. And that is not uncommon. And so literally with kitties, when you're switching diet, especially if it's something that's very different texturally and taste-wise, you may have to start with a half a teaspoon or a teaspoon per meal, mix things together, and then gradually switch them over. And there are cats that simply are not going to have a habit. They're just not going to switch. So be prepared to take it slow. Hopefully your kitty is one of those that thinks everything that's not nailed down is fair game to eat. So I hope that answers all the questions. And if you guys have questions right now, I've got time for a few more. Glad to see everybody hanging out today. I hope you enjoyed your tricker-and-treaters coming to the door and didn't eat too much candy. That's always the challenge for this year. That's all I've got for this week, unless you guys can think of any things. So until next week, remember, your pet's best health starts in the bowl. Take good care and see you next week.